So here's the cool part. No shrinkage. I've had 2 patients with a little post-op sensitivity. I'll show you one of the cases. It creates an appetite. So when you're creating this new crystalline structure to dentin, isn't that what we're all trying to do? That's what we're all looking for. How do we create this new, what I'd call, remineralization internally between the cement and the tooth? Bonding doesn't do it. We all know bonding leaks. I don't care what anybody says. When you're talking micro leakage, bonding can leak. And so to me, we're still in a huge world of what I call change. And this product is all about change. It's a hydrophilic system, which is what you're looking for. You want it to be attracting to water, and you want it to be alkaline. Now why? Imagine now you've cemented your crown, and right at your margin, you know you don't have a perfect seal. A perfect seal is like a 60 micron gap. That's a perfect seal, and there's still a gap. And if it's not a perfect 65 micron gap, then you're dealing with a larger gap. So what happens? Bacteria release acids. The acids are then obviously eating away at the tooth structure at the junction where your margin is. Well, this is alkaline, and it's long-term alkaline, which means it's basic. So it's acid resistant, and so as a result, you want to have something being what I would call resisting the constant attacks from our diet and bacteria in our mouths. We'll talk about the biomimetic properties. This bonds to the tooth structure, and I'll show you closely how it does this. It bonds. It's not traditional bonding. What happens is you, as you triturate, after you activate the water and you triturate, you get a powder to water reaction. The particles dissolve in a dissolution type moment. The nanocrystals start to form upon each other, and they also then form and bond to the dentin and seal the enamel. So you get an immediate stable sealing of the interface, and this nanocrystal technology, and we're talking nanocrystals, start to integrate into the dentin and tooth structure. And this is what's all new. So you have a basic pH, chemical stability, and no shrinkage, and you have a sealed interface with far less risk of secondary caries. Okay, this is the song I've been waiting to hear about cements. And there's more benefits. When you're cementing implants, and I'll show you this if we get to it in our last case, one of the biggest problems, up to 25% of peri-implantitis cases, is because doctors cement implant crowns and can't remove the cement. Many times I'm using screw downs. I use a screw access hole because if I can't clean the cement, where's that cement going to go? It's going to create inflammation in the weak hemidesmosomal attachment around the implant crown. So you got to be able to remove this cement. Now, in the pictures on the right, you can see the white opaqueness. Now, routinely, I never put this much cement, but I wanted to show you. Look how easy this peels away. And there's a whole different technique for cementing implant crowns. In this case, I just wanted to show you, here's excess cement peeled away after 3 minutes. So this is great tissue compatibility. That's what we're looking about, tissue compatibility. Most other cements, not tissue compatible. They create inflammation.